Thank you. Thank you.
All right, thanks, Jamie. Welcome, everyone, to our presentation. Thank you for joining us. My name is Lesther Papa. We're going to be introducing ourselves more formally and joined here with Christina and Ali, aka Alexandra. We've also been working with our advisor, Dr. Domenech-Rodriguez, as well. And so we together have organized this presentation in order to give you some ideas and some information about culturally competent supervision. So more specifically, what we're going to be covering is, after our introduction and the chance for you to get to know us, we're going to be going through different models of culturally competent supervision, talking about roles supervisor can take, and then talk kind of intermittently about supervision in groups versus individual, then move on to guidelines for culturally competent supervision, and then finally give you practical recommendations based on knowledge, awareness, and skills.
And we're going to really focus on the practical recommendations, particularly since it sounds like all of our members today are supervisors. We feel pretty confident that you're aware of different models of supervision and different roles and so forth. So we want to be able to have you walk away from this webinar with things to actually take back, different types of experiential exercises or assessments and so forth to be able to use in your settings.
So let's go ahead and get started, and let's start by introducing ourselves. So again, my name is Lesther. I am a Filipino-American. I'm a fourth-year graduate student at USU. I identify as a cisgender man. I take a humanistic and multicultural feminist approach to therapy. I'm specifically interested in working with ethnic minority families and children.
I'm Christina Patterson. I'm also a fourth-year graduate student at Utah State University. I came in with my master's, so I'm kind of technically a sixth year and ready to be done. I am a cognitive behavioral therapist with a critical race, feminist critical theory broadly flair, and I will talk a little bit more about what that means in just a moment as well. I am white and Latina. I identify as a cisgender female. I am agnostic and identify as queer. The reason I wanted to outline the critical race component and critical theories broadly is that it's the lens in which I see the world, and as the lead presenter on the webinar, I've asked myself, Lesther, and Ali to kind of structure around a critical theory basis. And when we refer to different cultural competence items, we will be addressing them in the way that they come from kind of a Eurocentric white model and how that might influence the way we interact with one another. And this is me. Not pictured is our advisor, Melanie Domenech-Rodriguez. She is all of our advisors up at Utah State University. She is also a supervisor for some of the clinical work that we do. She is our diversity and ethics instructor, and also somebody that is used quite frequently for cultural consultation in different clinical settings. And so a lot of what we've learned and put together was also in collaboration with her. And although she's not present on the webinar today, we wanted to acknowledge her and her role for us.
And I'm Alexandra Reveles. I am actually a third-year graduate student at the program here at USU. I identify as a cisgender Latino woman. I also identify as bisexual. I come from the Midwest, which is a pretty big part of my identity as well. So far in my training, although I'm at the very beginning, I have taken a multicultural feminist stance, and I have about 1 year of clinical experience under my belt.
So one of the reasons we wanted to introduce ourselves is, one, you can't physically see us, so it's kind of always an odd situation, and also because the way that we engage with supervision, the way we engage with therapy, the way we engage with the world is based on who we are as people. And our model is that in order to understand how we approach our professional and personal lives, it's important to understand our identities. These are by all means not all of our identities, but the ones we felt would be relevant in the discussions we'd be having today, so we wanted to highlight those. And when we go forward, when we talk about these different models or different roles or different skills, all of them were agreed upon by our group based on our identities and our lens and the way we wanted to present information to you. So we thought it was important to highlight that as well. As we go through these things, we would encourage you to also think about the different identities that are coming up as salient for you as we go through this presentation. Okay, so let's go ahead and get started.
So what we want to do first is introduce kind of the framework that we're going to be working from, which is the cultural competency model. This is based on Sue's tripartite model. And the three parts are knowledge, awareness, and skills. So when we're talking about knowledge, we mean cultural knowledge. So different facets of identity and knowledge, the majority and minority. So who is in power and who are people that are oppressed. When we're talking about awareness, we want to focus on awareness of the self and awareness of others. So this is going to generalize awareness of self as a supervisee, as a supervisor, and an awareness of others. So being aware of your supervisee or of your supervisor, and also the client's identity. And then finally, talking about skills. So in our previous webinar, we talked about this idea of dynamic sizing and scientific mindedness. We're going to be using some of the same skills here when a supervisor kind of explores with their supervisee their own kind of internal stance and values, and then encouraging the supervisee to gain knowledge of their client through cultural competence. And we're going to talk a little bit more in depth about that.
Okay. So let's talk a little bit about models of supervision. We're going to briefly cover this and talk about the model that will be coming from more extensively after this. We just wanted to provide an overview because we wanted to acknowledge that numerous models exist and that we purposefully chose a certain way and why we chose that way. So broadly, they kind of fall into three different categories: psychotherapy-based models, developmental models, and integrative models. Psychotherapy-based models are supervision models that are similar to a psychotherapy style, such as psychoanalytic, CBT, or person-centered. And these would follow similar structures that you would see inside of a counseling session. So a CBT style, for instance, would have the supervision process engage with some kind of instruction and learning and homework and being able to engage in a very structured supervisory setting, etc. Developmental models, such as the integrated developmental model, and these tend to focus around the development of the supervisee, so from a novice to gaining some level of awareness and understanding of what it means to be a therapist and so forth until they're ready to be a professional out on their own. And then an integrative model is theoretically models that can integrate psychotherapy style or developmental needs or different components of different models to kind of address it, such as the discrimination model. When we were looking at supervision models, we decided we wanted to go with the discrimination model, and we chose that for a variety of reasons. One, it's pretty well documented in research. It's been around for a while. It's a pretty well-known model. We look at it as trans-theoretical, meaning you can integrate it with a psychotherapy-based model or a developmental model based on how the discrimination model is set up, and also because we feel that out of the models so we look at psychology as stemming from white Eurocentric background. It was developed predominantly by upper class white men historically, and a lot of our psychotherapy and developmental models are based on kind of white norms and so forth, and the discrimination model is not based on that and can be used with feminist and multicultural components that each of us ascribe to and a critical lens to address it from different cultural contexts and needs. So we feel it's the most applicable based on known and researched models. Again, by no means are these the only types of models, but the ones that we want to cover. And we're specifically going to go into the discrimination model a little bit more in depth and talk about the different roles within it and how that may play out with cultural competence specifically.
So let's go ahead and start talking about the different supervisor roles. Like Christina said, we're going to be pulling from the discrimination model. And so, according to the model, the supervisor is going to fulfill three different roles, either as teacher, counselor, or consultant. And so the teacher's job is going to be basically to provide instruction, to build skills. The counselor will provide empathy for their supervisor, or for supervisees. We'll see supervisee, not supervisory. And then finally, serve as a consultant. So someone who can provide and generate alternative interventions or alternative conceptualizations. Along with those roles, there are three foci that are also mentioned. And so the focus can be either on intervention, conceptualization, or personalization. And the difference between those three foci are that intervention tends to focus specifically on techniques and treatment. Conceptualization is focused on integrating the information to understand clients. And finally, personalization is going to be kind of a self-reflexive process where you look at your own responses and defensive. When we put these together, they make a 3x3 matrix, and the supervisor will kind of respond to the supervisee's needs kind of within the cells of this matrix. So for example, when we're talking about conceptualization, personalization, and intervention, and when we try to tie that with cultural competence, conceptualization helps connect the knowledge piece there. So knowledge of your client and how you integrate that into a story, into something that is cohesive that helps you understand where this client is coming from. In terms of personalization, that is going to be your own awareness of yourself, your own prejudices, your own biases, and being aware of what your client also brings into the room. This also works for your supervisee as well. What are their biases? What are their prejudices? And what are they bringing into the room that you can work with as a supervisor? And then finally, looking at skills. So intervention skills like your basic listening sequence, learning how to do reflection, summarizing, paraphrasing, and then also how to gain information in a culturally competent. For example, asking, do you have a spouse or do you have a partner, instead of asking, you know, do you have a husband or wife? And then putting that implicit assumption out there. So when we talk about different examples here, the teacher role with the intervention foci will then look at teaching. So teaching the basic listening sequence and teaching the skills that we mentioned earlier. The counsel role will take the empathic. So empathizing with their supervisee in terms of process, what it is that they're going through. If they had a pretty hard session, like being able to process what's going on internally, and also addressing any of their own kinds of resistance or defensive. Yes. And finally, to serve as a consultant. And so here, your supervisee is going to be conceptualizing the client, and then you'll be there to provide alternative explanation or alternative models to conceptualize the client with the information given. So let's take a minute to pause and think. How would a counselor role fit with an intervention? The way we thought about it is a counselor is going to be there to provide empathy, right? So the counselor is going to be there to empathize with a trainee that might be struggling to learn some of the skills, or empathizing with maybe understanding why are the certain skills needed. Why is it that we need to be culturally competent?
One of the things to also think about in terms of group supervision versus individual supervision is that this matrix can look very interesting. So from the same aspect of intervention or the skills component of the cultural competence in a teacher role, if you are working with one student in or practicum or intern individual, the others could be learning through vicarious component. How do you address those differences, or how are they learning? How can they also develop the ability to become a teacher? So you're also modeling how to be a supervisor to these individuals. How can they engage in skills together and knowledge and awareness, and being able to have a reflective process as a group to be able to explore those identities and those awareness or biases and prejudices on that awareness component, or learn from one another so gaining that knowledge. So at the same time, while the supervisor is kind of in charge of the situation, a group dynamic looks quite a bit different because you have multiple people in which you're engaging in a teacher, counselor, and consultant. And in a group situation, you might have quite a few different levels of experience. And so how do you balance being a teacher for one person in that group while being a counselor or a consultant for another, and being able to be flexible in those roles and having the different foci in a way that makes sense for not only the individual person within that group that you're working with, but the group as a whole. And that becomes a different dynamic. Part of it is experience, you learn it as you go, and another part when we get to kind of the practical application at the end is how to be able to address it with your group in a way that everybody's getting their needs met, and being able to engage in a group versus individual supervision a little bit more openly and transparent, and discussing how they want to engage. So if one student, for instance, is not getting their needs met, they need more of a teacher role versus a consultant role, how can they have a voice in that process to be able to express those needs in a way that helps them versus makes them feel too vulnerable to engage properly. So we'll discuss that a little bit further down as well into how to potentially go about doing that in a group setting a little bit differently.
So now I'm going to go over some supervision guidelines that I have found. So the two biggest resources that I've used come from the APA and the ASTPB, and we're going to go into APA first. So this information comes from the Guidelines for Clinical Supervision and Health Service Psychology. I believe this came out in 2014. It's referenced at the end, but this is available online from APA's website. So specifically, I'm going to focus on Domain B of diversity. These guidelines are for supervisors in general, so this is the part that most pertains to our presentation. So one of the things that this diversity component talks about is supervisors striving to develop and maintain self-awareness regarding your own diversity competence. So this point really wants to drive home that you are role models for your supervisees, for us, for your trainees. So knowing that you're this role model and showing your supervisees that you're open to self-exploration, understanding your own biases, and that you're willing to pursue education or consultation when it's needed is really key in order for us to learn how to gain cultural competence ourselves. So having and demonstrating your ability to do these self-reflections.
Are you guys still there? All right, with apologies, we seem to have lost audio for our presenters. I'm assuming they will call back in momentarily. All right, well, we're waiting for them to reconnect with their audio. I'm going to do something that we would normally do at the end, which is thank the Trust for their sponsorship of our webinar series this year. We'll have 6 total webinars that are sponsored by them, and without their sponsorship, we would have some difficulty providing these to people for free. So that's a big benefit that we get from them. Also, I'd like to let you know that we are planning to post this webinar YouTube channel. So if you do have, if you'd like to refer back to it, or if you have people on your staff who weren't able to attend today, hopefully they will be able to view that later.
I think we're back.
You are back.
Oh.
Welcome back.
Okay, good.
Okay.
So sorry about that.
That's okay.
Yeah, no kidding. Oh,
so I went ahead and I skipped to the end and did our thank you. So we've got that covered for the end for the trust, but go ahead and dive right back in.
Great. Okay. So since we're running on like short on time anyway, I'm going to go ahead and skip through a little bit. So this next piece talks about enhancing diversity competence to establish respectful supervisory relationships and facilitate the diversity competence of supervisees. So really taking into account the infusion of diversity competence in supervision as being ethically imperative, and as well as respecting the human dignity of your supervisees and the clients or patients that supervisees work with. So being able to be a model to your supervisees, doing things like suggesting the use of the cultural formulation interview that we got from the DSM for use with culturally diverse clients that maybe a supervisee has, things like that. So the next point is recognizing the value of and pursuing ongoing training and diversity competence. So for you who are attending this webinar, you're doing this. Making sure that webinars like this, workshops, trainings, events at conferences, passing those things along to your supervisees so that they not only have the opportunity to gain these trainings, but they see you going to them as well, and knowing that this is an important piece of your professional identity and development that you're trying to maintain and foster even more. The next point is being able to be knowledgeable about the effects of bias, prejudice, and stereotyping. I'm sure many of you know there is a lot of literature out there about implicit bias. We have measures like the IAT, the Implicit Attitudes Test. I'm sure you also know about the literature on prejudice and stereotyping, stereotype threat, kind of how quickly we stereotype as humans. So making sure that you bring these issues up to your supervisees, that you're aware of them yourself, so that you know how they can impact your relationship with your supervisee if you come from different backgrounds, your supervisee's relationship to their clients, and kind of issues that might cause in the therapeutic alliance, and how to work those out within supervision.
One of the things I also want to add to that is that there is really limited research, but quite a need on exactly what Ali was just talking about in terms of an evaluative role. So supervisors tend to be in a power position over their supervisees because they provide some kind of score, grade, evaluation to look at their own competencies developing as a counselor and therapist. And one of the things to be aware of is that with your own biases, prejudice, and stereotypes of supervisors, whether or not that's impacting your ability to assess your supervisee who is culturally different than you in some way in a meaningful way. So for instance, if their communication styles are different, is it because it's a skill that they need to continue to work on, or is it because there's a cultural difference in communication styles? So one of the things to be aware of is not only knowledgeable about the effects, but how those biases, prejudices, stereotypes are specifically affecting that evaluative role.
And then the last point is being familiar with the scholarly literature concerning diversity competence in supervision and training. So basically this outlines knowing the resources that include competency-based training models for integrating diversity dispositions of supervisors and supervisees, and the duties that you have as supervisors to assist supervisees in navigating kind of inevitable tensions that will arise, that will and may arise between personal and professional values in being able to provide competent patient and client care. So from the ASPPB, again, they put out kind of broad guidelines for supervisors in general. I'm going to focus on the ethics of supervision and supervisor competencies that they outline. So within I guess we're going to go to supervisor competence. So with supervisor competence, they outline these different knowledge points and include diversity in all its forms. So knowing about diversity in terms of not only race and ethnicity, which I'm sure people think about right off the bat, but kind of thinking about sexual orientation status. Religion is a big one for us working in Utah, especially for those of us who don't come from the predominant religion of the LDS Church here. So being able to have knowledge about all these different forms of diversity. For the attitudes and values piece, again, one of the things they hit on is the sensitivity to diversity. So this includes not only being sensitive to diversity aspects of your supervisees, but their clients as well. And then for skills, discussing relevant multicultural issues within supervision, within practicum courses, if you have group meetings for group supervision, things like that, being able to talk about how your supervisee's African-American client may be going through a really hard time, especially with our current cultural climate regarding police brutality and the justice system in terms of the African-American population. So for the ethics piece, and again, this is more broad and general for supervisors as a whole, I wanted to highlight a couple different pieces. So keeping in mind that your supervisees may come from a different cultural background than you, may come from a different racial or ethnic background from you, and that these different backgrounds can be historically marginalized, we want to keep in mind these different areas of kind of harm that we could potentially be doing. So making sure, right, that we're not engaging in verbal or physical behavior that could be demeaning or harassing. I'm thinking specifically of microaggressions, so kind of really being aware of when these may show up, and if they do, being able to acknowledge them and take ownership of them so that the supervisee and you can still maintain a healthy relationship, and not delegating professional responsibilities to somebody who's not appropriately credentialed. And I think one of the main concerns that my colleagues and I had with this was the differences in culture and the way that people approach authority figures, and not necessarily, you may not even know that one of your supervisees doesn't feel comfortable doing something that you ask them to because they may never tell you about it. But just being aware that different cultural backgrounds have different ways of handling situations, so that you know what could come up if it should so happen that way. So for supervisor competence, as you'll see, there's this bullet point about multicultural competence. Going further through this guideline publication, there was no section that gave us specifically what they mean by multicultural competence, which is probably one of the reasons you're joining this webinar. So this, again, is a broad concept. They note it as being very important for supervisors to have. However, we're not really sure what that means. So hopefully going through this a little bit more will give you some ideas of how to engage in this type of competence.
And overall, a lot of these ethics and recommendations and guidelines are incredibly vague. That's purposeful, of course, as most ethical guidelines are, so that we can use professional judgment and experience to help guide us. But at the same time, if we don't have professional judgment and experience to guide us, we're not really sure how to proceed with that. So having something saying multicultural competence is important doesn't necessarily speak to how we create multicultural competence, how we teach multicultural competence, or certain guidelines. The APA does have multicultural competence recommendations and guidelines that we can absolutely provide for you that give quite a bit more in depth, but even then they're quite vague, and it's like, be aware that differences exist, be aware that we engage in behaviors with power over individuals, and how do we do that in a healthy, respectful manner, etc. And so the actual how does this apply and what does it look like in application piece tends to be missing from these guidelines. And so we rely a lot on the literature and research to look at what supervisees and supervisors point as being helpful or hindering in their supervisory experience. And then also, how do we actually use different techniques to engage those helpful or hindering different components of supervision. And so we're hoping to highlight more of that to provide some kind of guidance to engage in actual multicultural competence in a way that makes sense for you as supervisors, and then again for your supervisees, either individually or group. And we'll highlight how you can use some of these different pieces both individually and for a group as well. So we're going to spend the rest of our time kind of going through different examples of how to use these, and then field some questions and kind of wrap up. So, practical recommendations. Because we're coming from the cultural competence model of knowledge, awareness, and skills, we've outlined our recommendations from knowledge, awareness, and skills. And we're going to spend a little bit more time on the skills-based piece. And the knowledge and recommendations will be more overall directions to kind of point you in. Knowledge. We believe that it's incredibly important to continue to seek out knowledge about historical and contemporary issues such as privilege or institutional racism. These are words that get thrown around a lot, and a lot of people don't understand the context of it and what privilege means. When we highlighted our identities at the very beginning, some of those privileges existed inherently in some of our identities. So the picture of me, my skin is incredibly white. I am treated as a white person in this world, so I get the benefits of being white. Lesther gets the benefits of being male. We all have the benefit of education and experience. Institutional racism, how is not only education institutions broadly, but how are graduate programs, for instance, structured in a way that benefits certain groups more so than others? And are we doing a good enough job at helping those that are not privileged in certain manners achieve what they can achieve based on our own limitations and biases and prejudices? So as a person who is treated white in this world, can I understand and engage with a person of color as my supervisee in a way that makes sense for them because I understand some of the limitations or barriers they may face? Obviously, contact with diverse others, going to cultural events. Salt Lake has a lot, quite a bit and quite often of different large events, and then different areas, different campuses or different regions will have things that make sense to them. So seeking them out so that you can understand those cultures more organically in the sense that they happen within that cultural context. Attending group meetings, attending conferences. For instance, next year we have Division 45, which is for the research on ethnic minorities, and then we also have the NLPA, which is the National Latino Psych Association conferences. Those are fantastic places because predominantly the attendees, presenters, and organizers are people of color or other components, and so reaching into those conferences allows you to learn from what they consider important and relevant to the work they're doing and to them as people as well. And then seeking continued training. This webinar, although it's quite brief and quite an overview, it's hopefully getting your feet wet in ways that potentially they haven't been before. Professional meetings, again, same with that, and workshops. We are hoping to not only continue webinars, but do actual in-person workshops to engage with the skill component a little bit more often. We're hoping there's an interest. And then awareness. We have linked different inventories. We have the Cross-Cultural Counseling Inventory Revised, and we can send these to you via email if you're interested as well, because we have copies of these. And the Cross-Cultural Counseling Inventory Revised is for supervisees to evaluate, or supervisors to evaluate their supervisees' cultural competence as clients. So it's a Likert scale 1 to 6, and it's items like the counselor understood and respected their client's cultural heritage, for instance, and you can use that with your supervisee to look at how they're interacting with their client. The Cultural Competence Self-Assessment instrument is designed for clinicians themselves or supervisees, supervisors, to look at their own ability to understand who they are as a person. So it's got components like your own ethnicity and identities of race, your own understanding of how you communicate and what's important to you. And then we also linked the National Center for Cultural Competence based at Georgetown University, and this has a little bit of everything. It has modules for knowledge to learn about things like privilege and institutional racism. It also has different assessments that we don't have linked that you can use for yourself or for your supervisees, and then it also has different skills components as well. What kind of techniques can you actually use? And that's where we're going to spend the rest of our time. So skills. So we have the multicultural supervisory intervention.
So this came from the Sohelian et al. Article from 2014. This study surveyed a number of different students who were in supervisee roles and asked them kind of what worked with your supervisor, what did you think really helped. So some of the interventions that they noted as being particularly helpful are just things like facilitating the exploration of the supervisee and specific cultural issues, or discussing culturally appropriate case conceptualization. Pretty basic, but maybe things that we don't always think about as being particularly helpful. Again, focusing on therapeutic alliance of supervisee and client. These were all rated as very helpful from these supervisees in the study. So from some other studies, Christensen et al., supervisees said that having validation and support from their supervisors was particularly helpful. And these supervisees were from different backgrounds somehow, racial, ethnic, cultural, sexual orientation from their supervisors. They also noted that they needed a safe space to communicate and process these experiences that they had either with their supervisor or with their clients in session.
One of the things to note is also in a group setting, the safe space. So talking about potentially in the first couple of meetings of a group supervision, what kind of disclosures are we willing to discuss, and what is kind of off the table, and what happens if something occurs like a microaggression in that group supervision process? How do we address it? What do we want to do? One of the things that supervisees found unhelpful or hindering in this experience is if these conversations stayed on the periphery. Everybody was aware that these things were happening or multicultural events were occurring in some way, but it wasn't getting discussed or addressed appropriately. So some formal acknowledgement and willingness to engage despite discomfort can be incredibly helpful. So navigating that safe space in a group context versus an individual context looks very different, and you have to obviously be careful of how to do that. In the next slide, I'll give you an example of how to potentially go about that process, but it's something to note as important at this time as well.
I also wanted to point out that when we're talking about roles here, that for supervisees, they tend to be seeking out the counselor role from their supervisor. And if we're thinking about focus, then the focus seems to be on personalization here.
Okay. So how do we actually navigate these conversations? So I'm using the supervision model from Garrett et al. And these are components to address. I like the supervision model of this style because you can do it individually or in group. So the first part, V, stands for values and belief system, and interpretation of experiences ascribes meaning, structure of the world, interactive style, operational strategies, and need fulfillment. So let's talk about what this actually means. For values and belief systems, one of the things to talk to your supervisee about is what is important to you and why. This is a big question for a reason, because depending on who they are and where they are, depends on what they need. This is also going to help guide you in terms of that discrimination model. If they're a novice supervisee, what they might be looking for and what's important to them is just application of skills. I've taken all these classes and I have no idea how to actually use these skills. So it's important for me to actually have experience of how to apply these things in a session with a client. Other ways to look at what is important to you and why is, who are you as a person? What is your cultural context as an individual? So for instance, I come from a strong and close-knit family, so what's important to me will always be, number one, my family. Nothing trumps that for me. And so a value and belief system is when I go into a client session, I look at their own family. What is the role of their family? That's the lens in which I see it. How do they operate? Do they have the support? So if I have an LGBTQ client, for instance, are they provided that support by their family, or do they feel isolated or alienated? Or if they don't have a family, what is their friend support or social support in some way? So looking at those values and belief systems, because it'll inevitably play out in your supervisee's contact with their client as well. In a group system, you can also do this because this could be a really interesting way for not only you to learn about your supervisees, but for your supervisees to learn about one another. And this can be a bonding experience and a cohesive experience. And also, as they're learning to do that peer supervision process and learning to be supervisors themselves, they can understand a little bit more about the individuals operating in their group and how to provide feedback based on that context. Interpretation of experiences and ascribed meaning. So what's going on? What options, alternative points of view do you perceive? For instance, if I have a client who is different than me in some way, am I potentially seeing it from a way that makes sense to them? Am I only looking at it through my own lens? Am I only conceptualizing in one way? You can turn into the teacher in this way, teaching about how to conceptualize. You can also be that consultant role if you have a more experience with, okay, I understand you're looking at it from this point of view. What if it could be like this? And so forth. And again, with the group dynamics, they can learn to do this with one another. How can they help each other look at different points of view? How can they help each other understand that there could be multiple stories happening within that room based on an infinite number of worldviews? What is the structure of the world? How do you structure the relationship in the process? This can be, how do they structure the relationship in the process with their client? What's important? So for instance, is the therapeutic relationship something that's consistently addressed? What if there is a crack in that relationship? How do they engage differently? And then again, also this is the way for you to address with your supervisee. How do you think the structure of our relationship and our process of supervision should go? What are you looking for from me as a supervisor? Or what have you found to be helpful in the past if they do have experience? What happens if we have a disagreement or there's some discomfort going on? How do we address this? And then again, in that group component, how do we as a group want to address differences or discomfort or some kind of potential rupture within this group setting if something occurs? And having that conversation at the beginning makes it more easily accessible to come back to later on should you need to as well. Interactive style of learning. What is your preferred mode of communication? For instance, some people's communication styles vary. Some cultures, for instance, might have the supervisee in a role where they defer to a person of authority, which would be the supervisor in this instance, and being able to provide feedback to the supervisor might make them incredibly uncomfortable. And asking them to do so could put them in a very vulnerable position without understanding what their communication style is in terms of different roles with different people, compared to a peer component as well. And then also teaching your supervisees to appreciate different modes of communication as well with each other, but also with their clients. So how can they understand that perhaps their client isn't giving them everything? How can they also address with their clients that perhaps they feel their client is holding something back in session, and is that interrupting the session, or so forth, and having that become addressed within that situation. Operational strategies and procedures. How do you select and work towards goals? How do you prioritize? Some of that's going to go back to that values and belief system. So it's important for you to be able to address that with your supervisee in terms of the supervision process, but also to help your supervisee know how to do that with their client as well. How do you help them select and work toward goals? Are you projecting your own worldviews? For instance, if you have a client that is very collectivistic and you're a very individualistic person and they're worried about family dynamics, and your client or your supervisee is encouraging their client to separate themselves from the family, is that an appropriate way to select and work towards a goal? And then need fulfillment. What do you want or need in terms of the outcome? Meaning, what do they want from supervision again? What are they looking for? Are they looking for a consultant, a teacher, that counselor role? Are they looking for support because this is crazy, scary, and we have no idea what we're doing sometimes? And then also how to help facilitate that conversation in terms of teaching them to have that conversation with their clients as well. What do their clients need and want? How can we make sessions in a culturally competent manner that reflects what the client needs and wants versus what we think they should need and want? And then finally, we want to talk about the triad model. And this is an experiential exercise that stems from Peterson originally. We're going to talk about the original dynamic. And this is actually probably one of my favorite things that we have discussed in terms of providing for you. And we wish we could do a demonstration of it, but unfortunately it's a webinar and we cannot. So originally, this is a role-play exercise that has four roles. You have a counselor, a client, a pro-counselor, and an anti-counselor. So this is based on the idea that between the counselor and the client, there is always something happening in the client's head that is not being verbalized out loud in some way. It could be regarding content or context of the clinical session. So the kind of internal narration of what is happening in session. So the pro-counselor and the anti-counselor become that verbal voice. They hypothesize what is going on inside of the client's head. The pro-counselor verbalizes all the positive things that could be going on inside of the client's head. So for instance, if I am the counselor and I have my client, my pro-counselor might be narrating for the client that when I made a really great reflective remark to my client, they're like, that nailed it. She was on it. This therapist gets me. The anti-counselor now is the voice of the potential negative self-talk or session talk that is happening inside of the client's head. So if I make a misstep somewhere as a counselor, the anti-counselor could be like, she doesn't get it. She just completely invalidated my experience as a person of color, for instance, and they kind of narrate that process as the counselor and client are engaging in their role play. And this allows the counselor to understand different potential worldviews or conceptualizations that the client may be having. For your supervisees, engaging in a pro-counselor and anti-counselor way can also force them to engage in a client headset that might be different than theirs. So a white counselor could engage as a black client, for instance, and engage as a pro-counselor, anti-counselor, which would help them understand that the relationship might look different from the client and counselor point of view. We have also adapted it based on Magnuson, Norm, Jones, Krim, and Gentry, supervisor, supervisee, pro-supervisor, pro-supervisee, and anti-supervisor, and anti-supervisee. So the same process with the supervisor and supervisee as the counselor and client. And now the pro-counselor and anti-counselor is the pro-supervisor, anti-supervisor, or pro-supervisee, anti-supervisee. So what this does is allow supervisors to understand as well how the process of supervision between themselves and their supervisee is going, and allows the other supervisees to potentially narrate ways that allows them to be vulnerable but isn't their own reflections at the same time, so it can open up conversations. And inversely, having the supervisee and supervisor with the pro-supervisee and anti-supervisee, so that the supervisee can understand that perhaps the supervisor is also a person in this, and that they might be kind of the authority in this relationship. They're still humans with their own biases and prejudices. And so, for instance, if I have a lesbian supervisor and a straight supervisee, and the supervisee makes a comment about how they're not very comfortable working with LGBTQ individuals, now my pro-supervisee and anti-supervisee can have that verbalization of what might be happening to the supervisor in that moment, because now they're in an uncomfortable position potentially. Do I address it? Do I don't address it? How do I address it? What do I do? Now I kind of feel like I don't know about this person, etc., because supervisors are also vulnerable people. And so this triad model was designed on the counselor-client role to help up-and-coming counselors understand different points of view other than their own and take on different headspaces, and you can adapt it in a supervisor component as well. Okay, we're just going to wrap up with some resources. Due to time, we didn't get to spend as much on the other areas as we wanted. We provided our email. By all means, feel free to contact us with information if you want the scales or other components, etc. We've linked you to our lab webpage. We put on different resources in terms of community going-ons, different trainings and webinars and presentations, different experiences. It links to what we're doing in our own research and so forth. And then we also linked No Way But Through, and this is a TEDx talk by our advisor, Melanie. And this TEDx talk is basically what happens when you kind of screw up. What happens when you put your foot in your mouth in a cultural component, so you say something that is a microaggression, or you do something and you have no idea how to step out of it. Melanie has developed a step-by-step kind of plan to help people figure out how to engage with it in a meaningful way, hence No Way But Through. Here's our references. Okay, and we would like to, of course, thank the APA Trust for allowing us to present this free of charge for you as well. So now we're going to open up to questions for the last couple minutes.
If you do have questions, feel free to raise your hand and I'll unmute you so that you can ask them out loud, or you're welcome to use the question box or the chat box to type those in and I will ask them for you as well. For those of you who are interested in accessing the references, we will be posting this webinar to the UPA YouTube channel, so you'll be able to review it again later, where you are, of course, welcome to email the presenters and they can give you the information as well. But we do have the option for you to come and review this again and find out more on your own time. Do we have any questions today? All right, well, I'd like to thank you all for attending. I'd very much like to thank our presenters again for coming back and doing another presentation for us as well. If you do have questions that you'd like to pose to them individually, please feel free to email them. And if you need anything or any information about the Utah Psychological Association or the Early Career Psychologist Committee, please feel free to email me as well. Or you can contact me through UPA's website, which is utpsych.org. If we have no questions, we're going to go ahead and end the webinar. So thank you guys.
Thank you.
And everyone, I hope you all have a wonderful weekend.
You too.